Hi and welcome to EHI TV's first edition of 2012. I'm Shanna Crispin. eHealth Media recently held a roundtable bringing people from within the healthcare IT market together to discuss what could be in store for the coming year. Editor of EHI Jon Hoeksma chaired the event and is with me to discuss what went on. Welcome, Jon.
Hi, Shanna.
Firstly, tell me, you had a range of people from managers from within NHS IT and industry and consultants. Why bring these people together for a roundtable?
It's a good question. Well, it's been a year of big change, a lot of uncertainty, and we felt it would be a good time to bring a diverse range of expertise together to get them to reflect on the year that had been and to look ahead, shape of things to come in 2012. I mean, just to give you a quick sort of flavour, we had a very good panel. We had Joanne Shaw, the chair of NHS Direct. We had Justin Watling, who's the Chief Clinical Information Officer for BT Health. Christine Walters, who's a Director of IM&T at Pennine Acute Hospitals, together with a number of other participants. Between them, they offered a range of very interesting perspectives. There was some interesting conversations, a few points of disagreement, but it was certainly a very interesting round table. Okay,
so what did they say about 2011 and what needs to change?
Well, as I sort of alluded to, I don't think it would be a surprise to any EHI viewers that 2011 was a year of uncertainty, of change. The Health and Social Care Bill, the pause on the Health and Social Care Bill, the fact that it's still progressing now in the Lords. We're about to get the second Future Forum sort of report from Professor Steve Fields. All of that has acted as something of a hiatus when it comes to being able to make decisions on what comes next. And yet at the same time, the pressures on trusts to deliver that £20 billion Nicholson challenge on efficiency savings has only grown. It hasn't gone away.
Okay, so what did they say about what potentially could happen this year?
People were particularly sort of concerned that whilst we're in the wind-down mode of the National Programme for IT, that those key successes, particularly around infrastructure, around standards, around accreditation, around professionalism of NHS IM&T, that if we saw the pendulum swing too quickly to it all being passed to local decision making, we might lose some of that. We might lose too much. Things which have been preciously won could be lost. So there was a very clear message that came from the round table that there needs to be a clarity about what the purpose of the centre was. If it was focusing on standards and interoperability, that's great. But to move beyond sort of sloganeering to actually defining what that role would be. Okay,
so what's your general perception of what people are feeling like and what could be in store?
Well, the NHS is undergoing huge changes. I mean, I think it gets said a lot, but we can't say often enough that the NHS is facing pressures on a scale it just simply hasn't had before. The Nicholson challenge, which we already mentioned, the shift to entirely new commissioning arrangements, which has seen SHAs and PCTs disappear within just over 12 months. These are enormous changes. In addition to that, you then have a much stronger focus on patients having much greater say and control over their own healthcare, starting with access to their own healthcare records. You have a lot of trusts who feel that they've been held back by those areas of the national programme that fail to deliver. And a sense, though, beginning to come through that, of green shoots being spotted, of trust beginning to navigate their way through some of the challenges they face, and identify ways in which they can use IT as a genuinely strategic resource, not just as a cost or a necessary evil, but something that's going to help them manage their back office systems more effectively and deliver, crucially, more effective patient care.
Okay. Thanks, Jon. That's all we've got time for today, but to stay updated with current stories, keep an eye on our newspaper.